Hi, I'm Dr. David Marquis, and I've had the privilege of working in the field of functional medicine, functional neurology, and clinical nutrition now for about 20 years. My practice is in the central coast of California, in a small town called Arroyo Grande, just north of Santa Barbara. Today, my intention is to provide you with information that will be useful in overcoming pain through brain-based therapies. The conversation of pain can go a lot of different directions. It's a very unique experience and individualized. People all perceive pain and manifest pain in different ways. The commonality in the perception of pain is our receptor systems. We are receptor-based organisms. And when we look at the initial onset of pain, it usually is due to some type of nociceptive input. And to give you an idea of what I mean by that term, nociception is the adverse perception of your environmental sensory. So, like take our hands for example. We have a variety of different receptors in our hands that allow us to sense vibration, pinprick, pressure, temperature gradients, soft touch. And then we have sensory in our head where we're able to smell, taste, hear, and see. And there's other sensory within muscle, bone, and our GI tract. Regardless of where those sensory inputs come from, they all have to go through a certain process to get to the brain where it's actually perceived. And in the brain, it actually goes to a variety of different regions. We have to go into a region that involves memory. So we say, have I ever felt this before? We go into an associative center and we say, what type of pain is this? We go into a localization center and we say, where am I feeling it? And then we go a little further forward in the brain and we give it reason. And we say, is this pain rational and what am I going to do about it? Interesting things happen to people when they feel pain on an ongoing basis because our brain and our nervous system is plastic in many ways. It changes. And it can change for the better or it can change for the worse. When we have a patient presenting, and I'll give you a case situation, we had a patient that came in who was dealing with a condition called fibromyalgia where they felt pain all over. And concomitant with that, they also had chronic fatigue and brain fog. They had a very difficult time focusing, concentrating. In fact, their focus was so poor that when they sat before me in the initial interview, you could see that their eyes actually weren't able to engage and focus on me communicating with them. Much of their communication had to come through family members. And the lights in the room were actually more sensory input than they were able to tolerate. Communicating with that patient, that told me that there had been a process engaged for a prolonged period that had actually caused their nervous system to change in an adverse way. And this has become known as central sensitization. It's where an initial stimuli that might not be so bad at first starts to become perceived as noxious, and our body actually amplifies that. When that's allowed to go on for a prolonged period of time, there's signs that a physician can see when they're doing an examination with a patient. For example, this particular patient, their pupils were regularly dilated. This is why they were light sensitive. Even after sitting for up to 15 minutes, their resting heart rate was up in the 90 to low 100 range. And when you see a resting heart rate and pupillary dilation like that, you know that their system is being sympathetically driven. So in our nervous system, we've got the sympathetics and the parasympathetics, and when your sympathetic nervous system starts to become the driver of the bus, so to speak, you're going to have worsening in your health. It's going to slow down your digestive tract, it's going to speed up your heart rate, it's going to slow down your detoxification processes. And these are all things that you can measure and see when you're working with a patient. An interesting thing happens. I'm going to table that patient for a moment, but we will come back to them. When this process ensues and our brain is trying to process this information over and over again, it literally changes. And an example of this would be a situation where the plasticity of a certain brain region starts to enlarge or recruit those around it. I'll give you a case example of that. Individual who had lost his lower leg due to amputation after the limb had been injured irreparably. Subsequent to the amputation, this individual noticed that anytime they were sexually intimate with their spouse, they had great pain in the region of their genitals, but also they had great phantom pain in this limb that no longer existed. And those pains always coincided. And couldn't understand, okay, why would physical intimacy lead to my phantom pain engaging, and why would I recruit pain in another region relative to that phantom pain? And it was quite interesting because when you look at the brain, as I mentioned, those signals go to different regions. So it goes to regions of memory, it goes to regions of localization, and it goes to regions of reason. Well, when you go to that localization region, that's in our parietal map. It's also part of the somatosensory cortex. In that part of the brain, you literally have your whole body laid out. It's called a homunculus. And it's kind of an interesting drawing. When you look at a homunculus, you'll see that the hands and the feet and the lips are disproportionately large relative to the rest of the body layout on that map. But you think about that, and that's appropriate because that's where much of our sensory to our environment comes in. Well, when you look at the proximity of each of the different body regions, you'll see that the feet, the toes, and the genitalia are all next door neighbors right in the midline portion of that map. So when this individual lost their lower leg, they lost it due to a trauma. And so there was a lot of pain information coming out of that limb, talking to the brain on an ongoing basis up to the point of the amputation. The brain never had an opportunity to learn anything new as to it's okay to move and there won't be pain. Subsequently, that portion of the brain's last information that it received from that limb was pain. And then when the limb was removed, since that cell signal stopped coming, it literally recruited the regions around it, which happened to be the genitalia. Now, this principle can be applied in a variety of ways. What I just explained to you was a manifestation of poor neural transformation, and they call that transneural degeneration. And every day of our lives, we're either recruiting and building new neural synapses, or we're transneurally degenerating and losing them. And as we get into what we can do about brain, the pain that we're experiencing there in the brain, you're going to learn that it's really task mediated. We need to be very active and proactive in allowing our brain regions to stay differentiated. Back in the 60s, a couple of researchers named Melzack and Wall taught us a great deal about the neurology of pain, and they coined a term called pain gating. And it's the process by which our sensory input comes into the spinal cord, and it works through a number of circuits before it gets up to the brain, where it then goes through multiple channels there. What they taught us through pain gating is that we can actually inhibit interneurons, or the neurons in between the cord and the brain, to mask pain. And most people have experienced this in one way or another. You injure yourself and you might rub the surrounding region. In effect, you're gating pain by recruiting some of the surrounding neurons to bypass the region that was injured. Therapies such as chiropractic, osteopathic manipulation, acupuncture, physical therapy, massage, all of these modalities affect pain largely through this gating mechanism. So that is something that has been well understood, but it's temporary. If you haven't changed either the input, or if your pain has been protracted enough that you've actually modified or plasticized your nervous system in an adverse way, that won't be sufficient. Those are the individuals that need to seek care over and over and over again. These are the patients that have experienced poor neural regeneration, and in fact that input went up to a portion of their midbrain called the mesencephalon, and it began to overfire. And when we experience overfiring of the mesencephalon, what happens is that we start to experience poor cranial nerve function. And this is like that patient that I initially started to tell you about. So like the optic nerve, it became highly sensitized, and they weren't able to manage their pupillary dilation any longer because the light, the level of light in a room that was ambient and sufficient for everyone else to see, was too much for their brain to handle. And her heart rate increased, and so you can start to have tachycardia. You can actually have heart arrhythmias from this process as well. So the longer these processes are in play, the greater the probability of starting to take simple pain from the beginning and have it turn into other disease states. So remember that term transneural degeneration, because that's what we want to do the opposite of. So after a patient presents and we're going through the evaluation of where they're at on this continuum of brain function and how their peripheral and central nervous system are working or not, there's a few factors that I like to put into play prior to actually implementing any therapies. And you can kind of look at this as a spring cleaning effect before you're going to remodel the house, because you really cannot build on a burning structure. And so when an individual presents, I want to find out if they're managing their inflammatory pathways, if they're dealing with any toxic burden that they're going to have to work through, if they're optimizing their neurotransmitters, and if they're fueling their system appropriately. Those all have to be in place before we start these brain-based therapies to make sure that they will work. So one of the things that I really like to have people do is make sure that they get their genetics. In this day and age, there's no reason not to. The prices come down where it's reasonable for people to obtain a view of what kind of deck of cards they came to planet Earth with, so that they can determine where their inherent bottlenecks might be in terms of managing inflammation, detoxifying, and recycling and making their neurotransmitters. Assuming all of that is on board, then we can apply that same information as to nutrition. Where do they need the key support? Now, this is not a nutrition talk, so I'm not going to belabor that point, but suffice it to say that I have many other talks in that arena, and that needs to be taken into consideration anytime an individual is hoping to reshape their brain and their function. Two other areas that need to be taken into consideration that are kind of sidearms off of that have to do with gut-brain health, and then who's living in the gut. Any conversation about brain without discussing gut, or vice versa, is an incomplete discussion. The brain has a cranial nerve that comes off of it that's called the vagal nerve, and it innervates our GI tract. And that's not the only place that nerve comes up. I'm going to talk about that in just a moment. But it's a key nerve, and any time that nerve has been blunted in terms of its signaling to the gut, you're going to start to have inflammation in the gut, because the motility of the gut is going to slow down. That's when you start to see constipation, malabsorption of your nutrients. Well, if you start to experience inflammation in the gut, you actually start to change the flora, and the chemistry there starts to change. When your flora changes and you start to have more fermenting bacteria, then those bacteria that are responsible for the biotransformation of your nutrients and the manufacture of some of your neurotransmitters, your body actually starts to produce cytokines. The immune system gets involved. Anytime you hear inflammation, think immune system. And when the immune system's involved, now we've got a direct pathway back to the brain. So you can see it starts this negative vicious cycle where brain perception of pain overrides normal vagal input, has an adverse effect on the gut starts to become dysfunctional, who lives there starts to change, their output starts to change, and you start to develop inflammation that goes back to the brain, and then this worsens. So this is one of the ways that we transneurally degenerate. Well, once you identify that this is in play, you want to help an individual not only stop that inflammatory process, but restore normal flora within the gut lining so that you can bank on having the production of the neurotransmitters that you're hoping to achieve. In the gut, The family that is most important for neural transmission happens to be this bifidobacterium family. So you got the bifidobacterium angulatum, the bifidobacterium dentinium family, and those two are responsible for roughly 80% of your GABA production in the large intestine. And when you have that supply of GABA, GABA allows you to self-soothe, which allows you to down-regulate some of these portions of the brain that we were talking about earlier that get upregulated, like your memory of pain and your perception of it. It also helps your frontal lobe so that you can reason more efficiently. And this is the way that gut health has a direct impact on your perception of pain. So let's assume that all these things are handled. You understand your genetics, you're optimizing your detox pathways, you're optimizing your gut flora so that you can manage your neurotransmitters. Now we're going to get into fuel and activation. Fueling the brain really comes down to the process of making sure that we have adequate oxygenation. When an individual's vagal nerve starts to become inhibited or dysfunctional, their respiration, the depth of breath, starts to become more shallow. And as shallow breathers, which many people are, we tend to perfuse or deliver oxygen to our body more poorly. When that happens, we tend to become more sluggish and sedentary. And so the things that we're doing become less effective to us. They call this frequency of firing. It's important for us to stimulate our nervous system in a regular way. This is one of the reasons why exercise is so important on a regular basis, not just for our muscles, tendons, and joints, but for the brain. Because when we exercise, and today we're going to talk about specific brain-based exercises, but doing just physical exercise upregulates all these brain centers that I was talking about that are involved in the perception of pain. So let's talk about the effect of working one particular pathway, and that's the one that I mentioned earlier. We have our cranial nerves, and out of all of these cranial nerves, the one that I'm going to start with is the vagus, and that's that nerve that comes right off of the brainstem and goes into the gut. But it also regulates our heart rate. It regulates much of our insulin production, so think blood sugar control and our detox processes. It regulates our gastric motility and much of the acidity that's supposed to be there. And again, this is just a side note on that flora that we talked about. If you don't have appropriate gut acidity, you cannot keep beneficial flora. So that's a key tie-in right there. It innervates aspects of our lacrimal ducts, so how well our eyes water and how moist our mouth is. And very important, it suppresses inflammation in the body by facilitating the cholinergic anti-inflammatory pathways of the body. So this vagal nerve it's hugely important, and making sure that it's functioning appropriately is key. So much so that medicine has found ways that they can stimulate it by doing vagal stimulators. And so there's actually implants that if you've had a vagotomy where you've actually damaged your vagus nerve, they would go in and they'd put an implant in your chest, and they would wrap coils right around the vagal nerve so that it increases its frequency of firing in a timed fashion via this. It's basically a vagus pacemaker. So there's other ways outside of simply doing, it's not simple, putting in a vagal implant. You can do vagal stimuli on your own in a very healthy fashion by doing things like gargling while humming, because this stimulates your glossopharyngeal nerve and your vagal nerve simultaneously. You can take a nice hot shower and then right at the end of it, do cold water for 30 seconds. Cold water stimulates the vagal nerve. Deep breathing, so practices like yoga help to stimulate the vagal nerve. Doing things like Tai Chi, where you're working with motion and breathing. All of these activities help us to stimulate this nerve and increase its frequency of firing. And there's a saying in neurology that as we fire neurons together, they begin to wire together. So things that fire together will wire together. And so the more that we do for this, the greater the output's going to be on the backside. Our brain processes pain, as I said, in multiple regions. I've talked to you a little bit about some of the things that have to be in place before you can do some of the therapies to make sure that you're not working through this obstacle of inflammation. I've talked to you about tapping into the vagus nerve as one of the modalities. I want to share with you some of the other nerve pathways that we can work with and some of the ways that that can happen. We can also tap into auditory stem, olfactory stem, visual, and even our taste. So let's look at those for a moment, because these are all in the field of biofeedback. And in the field of biofeedback and in neurofeedback, they've shown that by just working these senses that I mentioned, you can down-regulate perception of pain predictably by 30 to 45%. That's pretty substantial for doing nothing in terms of a medicinal sense. Now you layer on top of that some of these other activities that I'm going to share, and you can actually get a handle on pain. So, working in the arena of biofeedback, one of those fields has to do with tying together a couple of modalities. And so one of them is heart rate variability. Heart rate variability is the application of matching our respiration with our heart rate. Many of us, because we become shallow breathers, we fail to engage our respiration in a useful fashion, and it's actually out of sync with our heart rate. When that happens, it actually creates signals of anxiety, which stimulates our limbic system to become a little more overstimulated, and this creates a sense of anxiety and even fear. And when you live in that environment, it actually upregulates your perception of pain. So although two people might experience the same noxious stimuli, the one who has an upregulation within their limbic center is going to perceive the pain in a greater fashion. We can tap into the auditory cortex. When we put stimuli into our ears, it innervates 60% of half of our cortex and 40% of the other, so you can actually cover much of the brain. And when you utilize certain brain frequencies, it helps to dampen again our limbic output so that we can down-regulate how much wind-up we get out of that. There's tools like electrical stim, and one is called a cranioelectrical stim, and you literally have leads that go on your ears that can put in frequency-specific input, like in the delta, theta range, even up into alpha, which can help to re-regulate some brain patterns. Or you can go up into the 100 hertz range, which is akin to throwing a reset switch onto the brain. We can tap into the olfactory system, and there's been a ton of research into utilizing our olfactory system for the attenuation of pain and our perception of pain. It's one of the cranial nerves that we have direct access to right through the cribriform plate as you go up through the sinus cavity here. And not only can you use olfaction, but you'll also be able to use laser light, which I'm going to show you in just a moment. There's tools like the AudioVisual Entrainment unit. There's one called the David Delight, which we use quite often, that has been very helpful, and it combines some of these modalities. So it uses photic stim, auditory stim, and cranioelectrical stim, or you can mix and match them as the patient needs. This is a great tool because you can be very specific to the frequency that you're trying to apply with the individual. So all of these therapies work in a neuro/biofeedback manner, depending on what you're monitoring, and they can all have a direct, immediate impact on how the brain perceives our input from our sensory. The other area that I want to go into is that of feeding the brain appropriately with oxygen. And we found some fantastic tools for this. Exercise with oxygen therapy is one of those. Exercise with oxygen therapy is a means by which you can upregulate your tissue perfusion, think extremities and brain, by upwards of 400%. Now, if you increase the oxygenation in these tissues, they're better able to carry out the task that you're asking them to do. We've been combining exercise with oxygen therapy with another device called the Vasper, and this is a wonderful exercise device that allows us to increase your nerve growth factor and your human growth hormone by 300%. Here's how it does that. This device puts compression through bands, they're just like large blood pressure cuffs, on your large muscle groups. So think about a large blood pressure cuff being around your both thighs and both upper arms. These larger muscle groups have a dense supply of mitochondria. Your mitochondria are little organelles within inside the cell that allow for your body to produce energy. When you're trying to repair a nerve and change a pain pathway, you need a lot of energy. Well, when you're utilizing the Vasper, you're exercising under compression, and these blood pressure cuffs actually have cold water circulating through them. And you ask, why would I put cold water on my body? Well, it's actually not touching you, it's just circulating through this band, but it does chill the tissue that's being worked. And here's the reason why. When you exercise under compression, it causes your body to release more lactic acid than you could ever do on your own. But when it's chilled, the lactic acid is actually denatured such that it won't cause tissue degradation or inflammation within the muscle that it's being released from. Normally, lactic acid creates a sense where you're going to be very sore afterwards. That very rarely, if ever, occurs on the Vasper. So now you've got this large amount of lactic acid being released into the system, and lactic acid, when it hits the brain, does something really interesting. The pituitary starts to register how much lactic acid is being released, and it releases nerve growth factor and human growth hormone relative to the volume of lactic acid. So the brain is perceiving that there's been some type of catastrophic event occur, and yet it hasn't, but it releases a volume of nerve growth factor and human growth factor relative to what it perceives has happened. So now your body has this rich supply of nerve growth factor. Plus, you've been doing the O2, so it's got the oxygen. So now your body has this huge supply of tools to repair itself with. And in fact, that's what we see. These devices are being used regularly within the athletic realm, both in professional athletes and Olympians, and they recover more quickly. Well, what we've found, and they get their pain knocked down, what we've found here clinically in the office is that it's been a fantastic tool for our neurodegenerative cases and our chronic pain cases. I want to share one with you. An individual who had had a stroke 13 years ago, and this patient became a quadriplegic from that, lost the capacity to speak because their basal ganglia, part of their midbrain, had basically died as a result of this stroke, and no longer able to use arms and legs and no longer able to speak because they didn't have the respiratory capacity to move their diaphragm. So think vagal nerve, the thing that I was talking about previously. Over the course of 6 months in working with this patient, in utilizing these tools that I just shared with you, some of the biofeedback, neurofeedback modalities, the Vasper with the Live O2, and one that I'm about to show you called pulsed electromagnetic fields, by utilizing all these things together, this patient now is able to utilize arms and legs and able to talk of her own accord. And her initial goal when she came into the office was to be able to speak again. When I interviewed this patient about 6 months into the process, not only could she talk, but she shared a wonderful story with me that she had just gotten off the phone with her sister the night before, and for the first time in 13 years, her sister didn't want to get off the phone because she was able to understand her. When you think about an individual whose nervous system had been transneurally degenerating for 13 years secondary to this trauma, and being able to turn around in that short a period of time, that opens my mind up to unlimited possibilities. And I hope it does for you as well, to recognize that the time factor and the amount of inflammation that an individual might be under are not stopping you from progressing if you address them and apply appropriate principles. Let me go back to that first patient that I told you about earlier, the one that came in with the chronic fatigue and fibromyalgia, well over, roughly 125, 150 pounds overweight. The weight has come off. This patient has their life back. Eyes are tracking now, able to focus, able to engage, so much so that they're actually able to invite people over again and socialize. quality of life has come back simply through stopping the inflammatory process and starting to engage these pathways in a beneficial fashion, stopping that transneural degeneration. So we've been really pleased by tying together some of these therapies. That Vasper plus the LiVo2 has been a very powerful one for increasing oxygenation to the brain and the nervous system as a whole, and increasing that nerve growth factor and the human growth hormone, which, by the way, also has a wonderful effect on balancing hormones. I mentioned laser and pulsed electromagnetic fields, and I just want to touch on those for a moment. Pulsed electromagnetic fields have really come a long way. The acronym for that is PEMF, and the devices come in a variety of shapes and sizes. The type that I use is actually a bed and a chair, and they have multiple electromagnetic coils in them. Fascinating thing to me is that they work much like the new iPhone and those Samsung phones that charge wirelessly. When you put your body in the environment of an electromagnetic field at the frequency, roughly in the 7.8 hertz, you're now into Earth's electromagnetic field, and it's akin to grounding. Our body actually charges itself and restores cellular function when it receives electrical input in that range. Quite different from the EMF that we would get from our lights and our computers and our TV. It actually counters that. So in effect, when we put a person onto this, we'll load them up with electrolytes so they have those free electron donors, put them onto the PEMF so that their body can start to recharge itself, and then we'll do some of these activities that I just talked about. Another aspect that I mentioned briefly, and I want to go into a little bit more, is laser therapy. Laser therapy has shown to be an amazing tool for the mitigation of pain, the healing of tissue, and one other aspect that is pretty amazing, and it is literally the pruning of neurons. So earlier I used a phrase called central sensitization. Central sensitization is where you have experienced a pain or a sensory over and over again, and you've literally, in an aberrant growth manner, changed the partitioning of your spinal cord, and you've recruited new pools of neurons in the brain to facilitate this noxious stimuli. Well, for you to be able to undo that, you need to be able to prune. And normally your glial cells, their job is to prune, but they can also have a bad job of facilitating what I just described. Laser light in the 635 nanometer range has the capacity to stimulate them in a beneficial way so that they actually start to promote proper pruning. And then if you're doing these other things, stopping the inflammatory process, feeding yourself, giving yourself proper fuel and activation, that pruning will work in a beneficial fashion. So there's lasers that you can lay on, there's lasers that can be applied locally to portions of the brainstem, and they actually even have intranasal lasers now that you can wear while you're reading that stimulate the cribriform plate, go right up into the brainstem there. So once we get a patient to the point where they're starting to progress and their inflammation is under control and we're seeing that progress, as I mentioned earlier, it's really important to always have proper stimuli and maintain that frequency of firing so that they're learning new things. So if you enter a functional neurologist's office like ours here, you might see one of the devices that we use is called a neurosensory motor integrator. The acronym for that is NSI. Basically, it's a glorified touchscreen. It's this huge TV that's about 5 feet across, and it has built into it a variety of exercises or activities that allow us to work an individual and give them tasks that they can do to always train new brain regions. You use all the things that I talked about. There's vestibular stim, so it might be things to do with how the head's moving. It might be some of the auditory input, some of the tactile work, some of the visual stim. All of these things can be tied together in a timing fashion to increase the workload that the brain can tolerate. Now, as you work these pathways, some beautiful things happen. So like that patient that I talked about that had the pupillary dilation where they were photosensitive. and their bowels were too slow because the vagus wasn't talking to the GI tract, and their heart rate was so fast that just sitting there made them uncomfortable. Over time, as you work these pathways and the brain starts to talk with the body again, all of these signs and symptoms begin to abate, and the individual no longer has to wear sunglasses in an office setting. And they're able to increase their own physical activity because their resting heart rate isn't in the 90s and 100s any longer. And their detoxification processes have improved such that their bowels are working normally and they're no longer as inflamed as they are. My goal with patients, and something that I would encourage you to understand, is that we each need to understand our genetics. What kind of deck of cards did we come to planet Earth with that allows us to go down these pathways so that you can optimize your inflammation management, avoid and eliminate those things that you know to be inflammatory to you, whether it be dietary or environmental, and get your inflammation as low as you possibly can. Feed yourself appropriately. Here in the United States, we have done a horrible job by overcarbing ourselves and underfatting ourselves. We need more healthy fats. Your central and peripheral nervous system need fats. A wonderful book by Dr. Dale Bredesen. I would encourage you to read this one, not necessarily to do with pain, but it's Reversing Alzheimer's. And that particular book will teach you all about ketosis, and another one by Dr. Mercola, Eat Fat for Fuel. Identify your detox pathways, optimize those, and then you're ready to rewire your brain. Functional neurology is the field that is shining in teaching people how to do this right now. If you can't find a functional neurologist in your area that practices functional medicine, call my office and we will help you find somebody. You can get better if you apply these principles. It just takes time. I hope that this has been helpful to you, and I appreciate you listening this far. And if you have any questions, don't hesitate to give my office a call. I wish you the best of health. Thank you.